Hello everyone, today we'll talk about immunodeficiency. What is immunodeficiency? Immunodeficiency is a disease results from the absence or failure of normal function of one or more components of the immune system. So this is a disease condition that is result from the absence or failure of one or more components of the immune system. So what are the components? It can be B cell, it can be T cells. So due to the absence or failure of normal function of B or T cells, body can goes to a disease condition, a disease state, and this disease state is termed as immunodeficiency. Immunodeficiency disease cause increased susceptibility to infection in patients. These diseases are broadly classified into two groups. One is congenital or primary immunodeficiencies, and the second one is acquired or secondary immunodeficiencies. So immunodeficiencies are two types: primary immunodeficiencies and secondary immunodeficiencies. So what is primary immunodeficiency? Immunodeficiency resulting from an inherited genetic or developmental defect in the immune system is termed as primary immunodeficiency. It caused increased susceptibility to infection in patient from the childhood. Disorders are manifested to different levels, including abnormalities of T cells or B cells, or abnormalities of elements such as complement or phagocytes. So when abnormalities in B and T cells leads to immunodeficiency, these types of immunodeficiency is termed as specific immunodeficiency. When abnormalities in complement or phagocytes lead to immunodeficiency, this type of immunodeficiency is termed as non-specific immunodeficiency. Primary immunodeficiency disease may vary in severity from during childhood from mild to nearly fatal state. So what is primary deficiency again? Primary deficiency is the immunodeficiency that result from inherited genetic or developmental defects in the immune systems. So this is a genetic or developmental defects in the immune system. So primary deficiencies of B cells. Patients with common defects in B cell function have recurrent pyogenic infections such as pneumonia, otitis media, and sinusitis. Defects in B cells function result in recurrent pyogenic infections. Okay, so what is pyogenic infection? Pyogenic infections are diseases that produce pus. Okay, so disease that produce pus is termed as pyogenic infection. This can be pneumonia, otitis media. What is otitis media? Otitis media is the infection of middle ear or sinusitis. Okay, this is the infection in the sinus. If untreated, they develop severe obstructive lung disease from recurrent pneumonia, which destroys the elasticity of airways. So primary deficiencies of B cells can lead to several diseases. One is X-linked hemoglobinuria or XLA, immunoglobulin A deficiency, immunoglobulin G deficiency, immunodeficiency with increased immunoglobulin M, common variable immunodeficiency, CVID, or transient hypogammaglobulinemia of infants during infancy. So let's now talk about early B cell maturation fails in XLA, or let's talk about XLA. So X-linked hemoglobinuria is the model B cell deficiencies and was the first immunodeficiency disease to be fully understood in details. The underlying deficiency being discovered in 1952 by Dr. Ogden Bruton. Affected males have few or no B cells in the blood or in the lymphoid tissue. Consequently, their lymph nodes are very small and their tonsils are absent. Their serum contains no immunoglobulin A, M, D, or E, and only small amount of immunoglobulin G. For the first 6 to 12 months of their life, affected males are protected from infections by the maternal immunoglobulin G that cross the placenta in the fetus. As the supply of immunoglobulin G is exhausted, they develop recurrent pyogenic infection. If they are infused intravenously with large doses of immunoglobulin G, they remain healthy. The XLA genes lies on the long arm of the chromosome. So where it's like in the long arm. This is the short arm of the chromosome, and this is the long arm of the chromosome. So this the gene that is responsible for XLA disease, it lies in the long arm of chromosome here. This is the site of many other hereditary immunodeficiencies, and the localization of these genes facilitates prenatal diagnosis. So, diagnosis of this disease can help us identifying or early diagnosis of several other genetic diseases. For example, Wiskott-Aldrich syndrome, CGD, or SCID, these diseases. The gene that is defective in XLA has recently been identified as a B cell cytoplasmic tyrosine kinase. So BTK, okay, so the gene responsible for XLA is now identified as B cell cytoplasmic tyrosine kinase, or BTK, belonging to the SRC oncogene family. The bone marrow of males with XLA contains normal number of pre-B cells, but as a result of mutation in the BTK genes, these cells cannot mature into B cells. That's why the B cell deficiency occurred, and due to this B cell deficiency, XLA disease then developed. So let's summarize what is XLA. XLA is a disease that developed due to the B cell deficiencies and was first identified in 1952 by Dr. Ogden Brodon. So what happened in this disease? In this disease, a mutation in the long arm of chromosome that is identified as BTK, B cell cytoplasmic tyrosine kinase, can lead to abnormal or mutated B cells, and these mutated B cells cannot develop or get mature. That's why body faces a dramatic deficiencies in the B cell, and these deficiencies in B cells lead to ultimately XLA. So primary deficiencies of B cells can also leads to deficiencies in immunoglobulin A and immunoglobulin G. Immunoglobulin E deficiency is the most common immunodeficiency. 1 in every 700 Caucasians have the defect, but it is not found or is found only rarely in other ethnic groups. People with immunoglobulin E deficiency tends to develop immunocomplex diseases like type 3 hypersensitivity. We will discuss in details about the type 3 hypersensitivity in our next chapter. About 20% of immunoglobulin A deficiency individuals also lack immunoglobulin G2 and immunoglobulin G4 and are therefore susceptible to pyogenic infection. As we already know, immunoglobulin G protects our body from pyogenic infection, and pyogenic infections are the infections that create pus. This class and subclass deficiency results from failure in the terminal differentiations of B cells. Primary immunodeficiencies of B cell. Now we will talk about CVID. T cell signaling to B cells is defective in CVID. So when T cell signaling to B cells gets defective, it causes common variable immunodeficiency or CVID disease. Individuals with common variable immunodeficiency have acquired hemoglobinuria in the second or third decade of their life. Both males and females are equally affected, and the cause is generally unknown, but many follow infection with Epstein-Barr virus. So some guess that EBV can cause CVID disease, but it's not really fully discovered yet. Patients with CVIDs are very susceptible to pyogenic organisms and to the intestinal protozoan. For example, Giardia lamblia, which causes severe diarrhea. Most patients with CVID have immature B cells that fail to receive proper signaling from the T cells. Most patients, about 80% with CVID, have B cells that do not function properly and are immature. The B cells are not defective. Instead, they fail to receive proper signaling from the T cells. The T cells defects have not been well defined in the CVID. So what happened in the CVID? In CVID, in most patients with CVIDs have B cells that do not function properly. So B cells will not function properly in CVID. As a result, they fail to receive proper signal from the T cell. The T cell defects have not yet well defined in case of CVID. Patients with CVID should be treated with intravenous gamma globulin because it provides protection against recurrent pyogenic infection. Many patients develop autoimmune diseases, most prominently pernicious anemia, but the reason for this is still unknown. CVID is not hereditary but is commonly associated with MHC haplotypes, for example, haplotypes HLA-B8 and HLA-DR3. So, although CVID is not hereditary, but they are commonly associated with the haplotypes of MHC, and the haplotypes are HLA-B8 and HLA-DR3.